Hello, hello, hello. Thank you so much for joining us today for Ask Miss Jai Live. I am so excited to be here today with my colleague, Opulence Abundance, who is just phenomenal. So I'm really excited for us to sit down and have this conversation. If you are joining live, go ahead and put a hashtag live in the chat. You can ask us questions in the chat or in the comments as well, and we'll be able to answer them on air. Or if something just springs to mind for you and you're like, I want to make sure this is part of the discourse, then feel free to put that as well. Or if you're catching this on the replay, go ahead and put a hashtag replay and let us know what you found most interesting about our conversation today. My name is Miss Jai. I use she, her, and he, him pronouns. I am the host of Ask Miss Jai Live. We're here every week on Sundays at 5 p.m. Mountain Standard Time. Right now, it's Arizona time. So right now it's Mountain Standard Time. Maybe it will change again. I'm not sure. I'm not paying attention to changes because we don't follow daylight savings, but it's 5 p.m. somewhere. Um, we are going to just jump right into it. So, Opulence, please introduce yourself, share a little bit about yourself and what you'd like to talk about.
Hi, everyone. I'm so excited to be here. My name is Opulence Abundance, they, them pronouns. I'm a speaker, a facilitator, a healer, and I enjoy working with relational networks, groups, individuals to help them navigate conflict in new ways so they can build power together. And that's really what I'm here for us to do is to build our authentic power together.
Mm, thank you. And what does authentic power mean to you?
I think that we as people are so powerful. And when we're able to build strong relationships, our ability to bring our visions to life, to experience things beyond our imagination, to set intentions and make those things come true, it just magnifies. Both when we build with ourselves, build our self trust, like determine our values, set clear intention. I'll start focusing on aligning with our values. But then when we're able to do that with community, when we're able to articulate our values, find like minded people, kind of like us, we're able just to achieve things beyond our imagination. And I feel like there's so many forces in the world kind of seeking to manipulate us or kind of have us do things that check us out, like have us scrolling Instagram forever. And so when we're able to sort of call our power back, call our attention and focus back, we can just do tremendous things.
Mm, yeah, thank you. What drew you to this work originally?
Wow, these questions are so good, Miss Jai. So this work around power specifically really just comes from my lived experience of being a young intersex person. And I know that not everyone may have heard that term intersex, but for me, what that meant was I was 10 years old, assigned female at birth. Growing up in the South in a very white Christian conservative area. So only person of color. On top of that, I was a really hairy kid. I started growing my beard at the age of 10. And what that meant was that the people around me, sometimes my peers would be cruel to me, but what I noticed even in elementary school was sometimes my teachers would feel extremely uncomfortable around me. So and sometimes my parents would feel really uncomfortable or upset about my appearance. And so I kind of grew up in a world where I felt really disempowered and I really didn't fit. And then when I finally came into a liberatory framework that included space for my identity, it was revolutionary. And in that moment, I was like, wow, I am here to embody this existence. I'm not here to get rid of my beard, but I'm just here to sit in who I am and to show up as myself. And to take those steps towards collective liberation. And that's such a big, heady ideal. And, when I'm talking about building power together, that also feels really heady. But what it looked like was coming into awareness of my identity and finding sanctuary in the deep South in liberatory organizations that we're organizing for immigrant rights, we're organizing for LGBTQ rights, and these organizations like Southern Autonomy Ground, Project South, these organizations still exist today. And realizing that there was a way where I could claim that power. And then also having my peers speak out and talk about how Instagram was purposely using techniques to create digital addiction really opened my eyes. And then through all those experiences, I'm talking about organizing, I'm talking about understanding philosophy, realizing how we're being manipulated by my world. But all of these were happening in the context of incredible parties and potlucks and community moments and feelings of love and belonging that growing up, I truly feared I would never experience. So
Mm,
to come into such deep love and community really inspired me to do the work I do now, which is conflict navigation with individuals, with organizations, with communities, with couples, anyone who's trying to like integrate their experiences of conflict, be accountable, need support navigating conflict. I really want to be here for them because conflict is actually how we grow closer together. And in my own experience, because I had so much trauma, that was complex trauma. It was related how people close to me like treated me or rejected me, often in covert situations. For a long time, I struggled to be a community member. I would tend to get into conflicts with people, to ruin things, to sabotage. And so when I finally did a lot of healing and started to be able to like shift that pattern, I was like, oh, I really got to show up for the trauma babies of the world that want to be in our communities, but also need our communities to meet us where we are at. I know that was a long answer, but it was a good question.
Thank you so much for sharing all of that context, though. I think that it's if it was a short answer, it would feel really two-dimensional. Of like, how did you get here after your long life of living, right? Like, we
Mhm.
can't just summarize that in a short amount. And you touch on some really important points around the fact that like you can't just pull out one identity and say, well, this is the one identity that's experiencing
Mm.
trauma. This is the one identity that is experiencing joy. This is the one identity that's experiencing community, because we are a combination of our identities and we can't spindle them out individually. And I really appreciate your perspective and around conflict specifically and how that can bring us together, because I think a lot of us, especially a lot of folks in marginalized communities, aren't given the tools and the
Mhm.
infrastructure to support working through those things in a healthy and productive way. And so it becomes really challenging then to engage in community when it's like, well, I don't like this person, or that person is always really mean, because that's what we've been taught, is to be divisive in a lot of ways.
Absolutely. So much of what you're sharing resonates. I mean, when you talk about not separating our identities, I think about how I am a Southern person. I grew up in the South. It's undeniable part of who I am. And also, it's also the source of a lot of these feelings I had. And very often that they're like, it's so intertwined, the source of our suffering, the source of our identity and love and belonging.
Hmm.
It's very connected. And then also what you're sharing around what it's like for people of marginalized identities and how I really resonate with what you're naming because very often we're expected to be perfect. Sometimes there can also be subconscious ideas with people or in the space, which may be things like, um, you should be glad to be here. Or we're already doing so much labor just to include you. Why are you creating a bigger deal? And that can even bleed into people's subconscious ideas that they may just hold about conflict from their families, which may be things like, it's rude to disrupt things, or everyone here is agreeing. Why are you making it so that we can't all just be agree and be happy together? And that's why the type of conflict navigation I do, excuse me, is specifically transformative justice, which focuses on how can we transform all of us, not just the person caught, not just like fixing the person causing the conflict, but how can the environment transform along with the person And that's why conflict can also be generative, because sometimes people can have those ideas. And then when they surface, they can say, oh my God, actually, I don't feel that way truly. That was just an idea that was coming up in response to this moment that makes me feel uncomfortable, you know? But
Mhm.
yeah, it's so I think with that perspective, you can see like, oh, with people with marginalized identities, they can actually be really protective to spaces, right? Because we can bring, and if people are receptive to going into that uncomfortable moment of conflict with us to say like, this form isn't inclusive, or we really do need to check in about pronouns in our workspace. It can have a tremendous effect.
Yeah, absolutely. And you've named already a number of communities where conflict resolution and the work that you do, this transformative justice, it could be very powerful. So you named parents, you named peers, you named school settings, you named several environments, and I know that you've done a lot of work in healthcare settings. And so I'm just wondering what made you want to work with healthcare providers? Because a lot of the audience members are in health or public health fields. So, like, what made you want to work in healthcare environments, and what are some of the things that you've learned?
Wow, such a good question. So, my very first experiences of working with healthcare environments actually stemmed from an experience of healthcare trauma where a doctor approached me. My pediatrician, when I was younger, was like, wow, we haven't understood why your body is the way it is for a long time. Let's explore that. And I think that provider approaching me with such a genuine level of curiosity was really inspiring to me, because it sort of spoke to me to be like, oh, I actually don't understand my body either. And the idea that there are medical professionals who can have diagnostic tools to help me understand myself better, that's very powerful and appeals to me. Unfortunately, that led me to having both my first kind of like adult experience in a medical care setting. So, like, my first time going to the doctor without my mom, and like, unfortunately, that experiencing feeling dehumanizing, confusing, and also providing me with a treatment that actually um didn't how do I phrase this? It wasn't that it was like being given a medication that was recommended for my condition, but wasn't actually necessary for me, and ended up having significant negative effects on my body in daily life.
Mm,
So this experience kind of forced me to better understand my body, because I was like, oh, a lot of I was both like, I just became aware that the symptoms I was experiencing, a lot of medical providers weren't familiar with. And that's very common for intersex people. Traditionally, intersex refers to people who have one of 5 different conditions. And providers have sort of said, okay, these people with these 5 conditions, they are intersex. I think what's helpful as the general public is coming to terms with intersex identity is just to remember that intersex people are really common, actually. They say they're as common as redheads. It's about 1 to 2% of the population. And a part of that is that we as people very rarely get our chromosomes tested. So a lot of times people are intersex and just may not know. And that's why when we do hear about intersex identity, it's often in reference to the Olympics, because they do chromosomal testing.
hmm
So the reason that I call myself intersex is because I have an expression of polycystic ovarian syndrome, also known as PCOS. That term was used at one time to refer to people with cysts on their ovaries, but more recently, it's sort of like an umbrella term to refer to people who are assigned female at birth with unusual hormones. And so it is more and more being seen as an aspect of intersex identity. So I actually, while I was having this traumatic medical experience, took an elective in college. It was my first year of college, where I was learning all about the different gender and sex identities, and I was learning about intersex identity. So I was just uniquely equipped with these tools. I was coming into my identity. I had this experience. And I really look back at my younger self, and I'm so glad that I had, again, these resilient communities of magical queers in the South to receive me. And I was at that time living in Charleston, South Carolina. And I remember someone from the Alliance of Full Acceptance, um, which was like, an organization working to support LGBTQ people in the South. They had arranged to work with the Medical University of South Carolina and to give these presentations to doctors on how to like appropriately treat and communicate and even like screen for health risks for LGBTQ people. This was happening in like 2010, and it
Mhm.
was groundbreaking. Like, I cannot describe just how powerful that was, because
Yeah.
I believe that sodomy was still illegal in South Carolina until maybe 2003. I may be wrong, but I think it was actually quite recent that that law changed. So for someone to have access to people in power at a university like that to advocate was extremely exciting. And they invited me in to talk about intersex identity. So that's how I started working with medical professionals. And I still look back at that experience and I see myself as a young, like 18, 19-year-old talking to these doctors with so much confidence. And at times, like, just genuine passion, as my career evolved, I became to under like I came to understand myself as a part of the healthcare system, because I realized that I really liked healing. I liked working with herbs. I liked talking to people. And it made me think about the overlap between like traditional, formal, institutionalized medicine, and then herbal medicine, folklore, women's medicine, all of that. And I became a therapist. And then I actually became like a director at a healthcare center where I was helping manage the trans health program. And I established this program for people exiting incarceration. And during that time, I came to understand that people, if they are not given medical care within their first 30 days of release from incarceration, they are like 20 times more likely, unfortunately, to pass away. And it really made me understand that, like, our doctors are our frontline providers, and
Mhm.
supporting them and being in conversation with them is some of the most important things we can do.
Yeah. Yeah, thank you for sharing that. And I think about, especially for folks who have been recently released, going from being in a structure in a system that is harmful in and of itself, but does have structure for, we're going to make sure your medications are getting dispensed, you're having some level of access to care, to now being released and not having the resources, not knowing where to go, not being connected to a provider already, how jarring that can be for our bodies and for our well-being. And I think about, because I worked in a program that did HIV care, and when we had folks who were released, there was a really big push to connect folks to care immediately, because going off of your antiretrovirals can have a variety of health consequences, and that was also very difficult. And we had teams dedicated to support folks getting there. And so I think about, for folks who don't have those dedicated teams, how difficult it must be to actually get the services you need in order to survive and thrive post release as well.
Absolutely. I think that, like, as you're sharing, what you're naming is so true. I know that for people, it is just kind of the perfect storm of conditions just to create a huge risk factor, both in terms of stress, in terms of like being hit with the inefficiency of bureaucracy sometimes. I know that sometimes people leave and they're told different things about their insurance. There's just all these things that can happen in that transition. And as you share, I hear you both name care and teams, right? And it kind of brings us both back to like how powerful it can be to center around a person and create a plan, and
Hmm.
just like, hold their life as sacred and move them through care. And that, like, care is really at the root of medicine, and I think that's also what's interesting around working with people exiting incarceration, because one of the other factors was that oftentimes people receiving medicine in incarcerated settings may have some level of medical trauma or suspicion of doctors, may have some level of stigma, like maybe fear of self-stigma, or like fear of a doctor communicating um, with like their parole officer and that
Hmm.
resulting in them being reincarcerated. Or they may have had a traumatic medical experience while incarcerated. And so I think in working with people who've been released, I see myself in a lot of ways where I'm like, wow, we have to work through that trauma in order to get to the appointment, right? And it's so exciting when someone gets there. Sometimes it takes a lot of resources, energy, and work to get there, that we want to make sure that medical providers and like front desk staff and
Hmm.
everyone a part of the medical care team can really receive them.
Yeah, and that really is part and parcel of it, right? We could have a provider, we could have a physician who's really, really knowledgeable, really on the ball, asks pronouns, asks names, is respectful. But if we are entering into a health space and we're being misgendered by front desk staff, if we enter into a health space and we're being redirected by security because we're trying to use what they deem the wrong restroom, if we're entering into these spaces and other interpersonal conflicts arise related specifically to the way that we're perceived for our gender in those spaces, then that becomes an unsafe and a hostile environment, regardless of how amazing the physician is. And so it really is about like holistically, how can we support all of our staff to get to this baseline of supporting folks that they're coming into contact with frequently. And I want to move back a little bit to the intersex advocacy piece, because I think there are a lot of my audience members, but just like a lot of people in general, who don't understand not only the how common intersex is, which you mentioned, like anywhere between 1% and 2% of the population, but I think there's also a lot of assumptions that intersex people are just going to share that they're intersex when they come into the environment. And that's also not reality because of the safety concerns that folks may have, or the fact that providers might not know what they are, what that means. So, what are some ways that you've been able to support healthcare providers in being more affirming for intersex patients and clients?
Such a good question. I think that this question really goes back to some fundamental practices. And it starts with your mindset as a medical provider. Um, because what I have found is that baked into education around intersex patients, and this is historical, but it still happens. The whole subject of intersex is taught through this perspective of this is a disorder and it needs to be fixed. And sometimes that fixing will happen at the expense of someone's ability to experience pleasure,
Mhm.
or someone's ability to have body parts that are functional for them, because their body parts or their body in some way looks not just different, but like so far from the norm that doctors are taught that it has to be fixed.
Mhm.
And so it kind of gets into this idea, it touches on a couple things. One, it touches on what is healthy and functional and what do we pathologize, right? And then it also touches on ideas around gender identity, because I know a lot of physicians or medical providers might say, that's all well and good, but we need to do these surgeries on oftentimes infants, surgeries on patients under the age of 13, because there's a limited window of time to make these surgeries. And we think that this patient will want to have this procedure done later. Like they'll be essentially like later in life, they'll be thankful this happened, um, because they will be normal. And so in there is there is like, I will say, a conflict. Not necessarily, I'm going to touch on the research, but just in when you reflect on that, it's a tension of what is the stigma or the burden of not being normal? Does that outweigh potentially the trauma of having an invasive, unnecessary medical procedure done without your consent at a young age? I think that's where a lot of providers find themselves. And the institution of medicine, it's changing, but will very often pressure parents to have the surgery done for their children. And very often, medicine bears down on the side that it's better to do the surgery at a young age. I feel so embarrassed, but um, there's an intersex association, and I'm like blanking on the correct name for it. But what they advocate for is no surgeries on patients under the age of 13, under the age of consent. And for those surgeries, just to be evaluated and seen from a less judgmental light. And there is a large body of research, both I mean, honestly, mostly anecdotal, like qualitative research of people who have had these surgeries, and a lot of people who have had these surgeries and been lied to about them, who feel that these surgeries did not necessarily increase their quality of life. I think it's so powerful what you name, that sometimes the expectation is that people know themselves, they know their condition, they'll walk in and give you their medical history. When you share that, it really brought up the spirit of someone who I used to supervise, who was a trans person of color, that was a very passionate um, recovery advocate, worked in the field of harm reduction and substance use, a brilliant person that I got to work with, and who also taught me a valuable lesson around disability, where I didn't realize that they had a disability because they felt so hesitant to share it with me
Mm,
for fear that it would impact their employment. But it really taught me that when people walk into the room, we have to see them. And we can't always trust that they can have the words or even be in the place of power to tell us about their full self. In some ways, if I'm very honest, I relate to that as someone living in South Carolina. I'm like, okay, I got to go to the doctor um, in a place, where there's just a very large Christian presence. So a part of me is like, I need to go to the doctor. But when I go to this doctor, am I at risk for receiving judgment from this doctor through the perspective of their religious or cultural beliefs? So I think as providers, we just have to be really aware of that and how that might impact things. And also to understand the power and authority we have. As a young intersex person, my doctors often recommended things like electrolysis or laser hair removal, which I think it is helpful to give those introductory options to let people know that they can receive it. But I also wonder what it might be like for providers to create space for the care to be truly patient led.
mm,
So if a child is advocating that they would like their body to look a certain way, to provide those resources, but not to provide them off the bat as a standard treatment.
mm.
So I think like the recommendations I really have are to be reflective in that way, and to be open. The other piece of this is that I really kind of had to like talk it through with my medical providers to um to understand that this diagnosis can be connected to intersex identity. So I think just providers having an awareness that that might be like, that people whose bodies do not fit within like the clear gender binary, that there are these ways to identify. I think just increasing awareness of that can be helpful. I know that's a
Mhm.
little vague, but yeah, those are some recommendations I would have.
Yeah, it's helpful to recognize the fact that like just because someone is expressing gender in a certain way, has a gender identity in a certain way, that it doesn't mean that our bodies are necessarily going to reflect the typical characteristics that we might assign to those individuals. I think a lot about a family member who found out that they were intersex at the age of 25,
Mhm.
and found out only after an accident took place and they were
Mm.
receiving an ultrasound for their abdomen and found out that they had organs that were not typical to the sex they were assigned at birth. And so it was like
Mhm.
this moment of that this really is much more common than we talk about. And for a lot of folks that are existing in the world, they may have an intersex condition. They may be intersex and just not know it because, yeah, like you said, we don't get our chromosomes checked on a regular basis. It's generally not medically necessary for us to know our chromosomes. And really, we see that happen most in sports because of trying to ban folks based
Mhm.
off of expectations of what typical gender characteristics look like. And then I also think about like the legislation that's coming out around gender affirming care for folks who are under the age of 18 and how there are oftentimes carve outs and exceptions that are developed because of, again, this idea of we have to fix intersex infants. We have to fix
Mhm.
people because the body needs to match what we would think of as typically that sex assigned at birth. And often that's from an external a visual external look as opposed to what's actually going on for the individual's body.
Absolutely. I think that, like, the more I've researched intersex identity, the way it's shifted things I think about, thinking about sex as a checklist of, like, like, in there that might be, um, reproductive organs, chromosomes, hormones, secondary sex characteristics. So there are all these different things, parts of our body that make up this one identity. And also understanding that, like, yes, being intersex is common, but then there's also the research of Anne Foster Sterling, who some of her research may be outdated now, but was at one time one of the few voices around intersex identity in the field. She also had this other category that was someone who wasn't intersex, but had some part of their identity or their like, when I say sexual identity, I don't mean orientation, but like the things that make up male or female, that had things that had significant variation from what we might consider normal. So just to kind of have the insight to see these all as just standards that were created by humans, some of them being arbitrary, like what is a normal level of estrogen or testosterone, right? And some of those are connected to research. I'm not saying to dismiss them in any way, but just holding greater, I don't know, I guess just holding an awareness that, like, all these things make us up to
Mhm.
be who we are, and there might be variations in these things.
Yeah, for sure. So, in supporting providers to give care to trans and non-binary people, but intersex people as well, how what does trauma-informed care mean to you around that, and how can a provider support a client or a patient in a trauma-informed way?
Love this question. Um, I'm having this flashback to I recently went to a checkup, and the doctor kept saying, "Okay, we're just gonna do a checkup," and I kept saying, "What does that mean?" And he kept saying, "We're just gonna do an ordinary checkup," and I kept saying, what are you going to do to me? So I'm really glad I can answer this question from my perspective. So I think the first things are, when working in a trauma informed way, specifically with intersex patients, but also trans and non binary, I would say that providers need to put on a special cap of compassion to understand that their patients might be triggered in these settings,
Mhm.
whether it's from receiving care that was not gender affirming and having a strong response, to maybe, for in a lot of medical settings, um oftentimes the experience is that you are called a name that might not be affirming to you over and over again. So just having a little compassion. And then the big one to be compassionate about, especially for intersex patients, is that there may have been some moment in their care where they were shown as an example or a medical oddity, or there was a lot of whispering around their body and
Mm.
maybe not directly acknowledging. They may also have wounds around, their parents feeling fearful or shameful about their sexual identity or gender or body in some way. There might have even been some trauma around secrecy. So just moving in with a lot of care. The other thing I would say is being able to, of course, use checking in and making sure you're using everyone's correct pronouns, name, not making those assumptions. And then what I see as really important is being able to one, describe what you're going to do. So in that situation with me and the doctor, what I wanted them to say and what they eventually got to was that they were going to pull up my shirt and put something on my body, and then they were going to put something on my back. And so being able to actually just describe exactly what you're going to do, and not doing, just in physical detail terms, to say like, yes, I'm going to do this and I will do this and I will do this. Um the other thing that feels really, really important is to, if you have a patient that is intersex or trans, it is to stay present with their symptoms or what their current experience is. This is kind of specific to PCOS. I know that a lot of medical providers learn patient has PCOS, give them metformin. But what I have come to learn about PCOS is that because it's an umbrella term, there are so many different things going on with people's bodies. Some people have an excess of hormones. Some people, like me, just have very low hormones. And that just determines what specific medical care they need. And that, yeah, just to stay present with your patient.
Yeah. Thank you so much for sharing those. It makes me think a lot about like what folks are getting support for as well, and going
Mhm.
in for a cold, which I'm fighting off a cold right now. Like going in for a cold doesn't mean that I can then be used as this medical example.
So
And
true.
like, and a lot of what you're sharing right now is this like we're we're here to treat the person based off of what their goals are for their medical care, what their goals are for what health looks like to them, and beyond just the let's be affirming and acknowledge their presence in this space, to not treat them as subhuman or as an oddity, to be kind of carted around the office and shown to other providers, because that can be really harmful and scary.
Yeah, the experience I think of is a provider walking out and then walking back in with a group of people and being in some state of undress or in some state of vulnerability. So when we go into medical offices, there's multiple layers of vulnerability. I think one thing that changed my life was when I got this doctor was like, "Oh, we should explore this." I didn't learn this until years later, but this is like small town medical drama kind of. But apparently, that doctor that encouraged me to get my hormones retested, her cousin was somehow employed by my insurance carrier, and me getting my hormones tested resulted in my insurance going up. And it was just an interesting moment of being like, oh, I'm in a small town and my mom is able to connect these people to these like corporations or roles, and feels that there was some, like, my mom felt that there was something going on. But to me, what I really saw was just like,
Mhm.
wow, working with a medical institution, you're physically vulnerable, and the things that people write in your charts will change your life forever. It can cause your insurance to go up, and it will determine how people in their future perceive them. So just always moving with care and awareness of your power.
Yeah. So then how, because this has some like red flags like popping up for me, right? So how do we get our
Yeah.
health needs met, and maybe trust isn't the right word, but move forward with realistic expectations around the health environment? How do we get our health needs met without sort of succumbing to this mistrust, distrust, that often pushes us out of care?
This is such a good question, Miss Jai. And, it's going to have the answer that I've brought up a lot, which is I think for me, the first step was community. So being able to find other people who shared experiences, being able to find other people who share the same identities as me. One
Mhm.
of the identities I hold is that I'm a fat person. And so, especially during COVID, I got really anxious about experiencing medical fat phobia. So I actually joined a bunch of Facebook groups and Instagram. I just followed a bunch of people in that space of fat liberation. And what I actually found was this incredible Facebook group that's still around called Caring for Our Fat Bodies, where people were sharing experiences and ways of advocating and also able to consult with each other on experiences they were having and if they were being gaslit, if they needed to continue to advocate. At the end of the day, we all deserve health care, and we deserve to be able to access and use the resources of like educated doctors and the tools that they have at these medical institutions. Sadly, what I know happened to me and I've seen happen to people is there was a time period where I fell out of care and I was relying on other modalities of healthcare, that were more community based, I'll say, but it was like, like an herbalist working out of their garage or something. And I think that's beautiful that that exists, but I don't think it's a replacement. And I think that like it is our right to access medical care through an institution. And it's really important because there are tools and preventive screenings that we need to receive. And trans people, intersex people, we need to live a long time. Okay. We have to be here for the youth. And a lot of us feel all the time what it's like to not have elders around that whose lives were sadly lost, maybe due to medical neglect or medical discrimination during HIV AIDS. There's
Mhm.
this whole legacy of medical neglect in our community. Um, so I think that kind of fires me up. I'm like, this is our right. We can't let this go. What has really worked for me is just building education and awareness of my body. I think coming out of that experience, I was able to have friends accompany me to the doctor. That was my big like light bulb after that experience to say, "Oh, I need to take someone with me. I'm so used to my mom being in the room. Let me take a friend with me." The other thing is that I look to see if medical institutions are teaching hospitals or
Mhm.
teaching clinics, those spaces you will have a group of people come
Mhm.
in, and that is like part and parcel of accessing that form of medical care. So the degree that it's accessible to me, I try to opt out from those spaces. But really what the other thing that has helped me a lot is to be able to confidently ask my doctors questions or advocate for myself. I know that I had one doctor who was like, "Oh, you have PCOS." And I was asking her questions about it. And I was like, "Well, this is my understanding of it." And I really celebrate that doctor because she said, "You're clearly more educated than me. Let me
Mm.
just refer you to an endocrinologist because I'm really not qualified to go deep in this with you."
Mhm.
And the other thing I really advocate for is that when I go to the doctor's office, I advocate to get my blood tested and to receive labs regarding my blood. And that allows me to have some, obviously, with the help of a doctor. I don't want to like say that I feel like I need a doctor to go over those results with me.
Mhm.
And it's also something that I can look at and have a way to measure and better understand my health, if that makes sense.
Yeah, absolutely. I mean, I think about looking at depending on where you live too, or how, like if you gave the example of a teaching hospital, you might be working with the same doctor at a teaching hospital for 3 years, and then their residency is over and they're gone. And so like
Yeah.
turnover in physicians can happen as well. So having our blood work, knowing what we want to get tested or what has been tested on a regular basis for us to better understand our bodies and where our health is a powerful tool, because we are going to have that record. We're going to have that information over a length of period much longer, and can bring up like, well, actually this is the way that my hormones have always looked, or this is actually high even though it's within a normal range now. This is actually high compared to the way it's been for the last 6 years, and so I'm actually concerned about what this increase means, or vice versa, right? So it gives us a lot more information when we feel ownership over that. And I really want to bring this, like tie this back to for the providers who are listening. If you're looking for how to build trust with trans and non-binary and intersex people, and I don't, not to categorize
No,
all
I
those
hear you.
folks in the same, yeah, in the same category because we're not, but like to build trust with these communities, it sounds like a lot of what we do is get information from our community, and when we are feeling disenfranchised with the medical community, when we're feeling distrust of the medical community, we often return back to our communal spaces in order to get support and understanding and information around how we should be moving through these spaces. So if you're an organizer, if you're a provider and you're wanting to support our communities, then you need to be working with the community organizations that are serving our communities already and with our grassroots and established organizations.
Absolutely. You said it perfectly, Miss Jai, because nothing makes me lose trust faster than a physician who is telling me than a physician who may not feel confident in the area of knowledge, or it might be a new area of learning, who is taking a hard line stance, you know? And what I'm really reflecting on is that there was a time in my life when I wanted to go on hormones. I went to my university healthcare doctor at the time. I was at the University of Southern California, and this doctor told me that because I had an existing hormone imbalance and I was growing a beard, she had not looked at my labs or at my blood or anything,
Mm,
but she said, "We would need you to stop growing your beard before I would feel comfortable putting you on hormones." Um, and all my friends who I had just moved at the time, so it really was just a community. Everyone said, "Don't go back to that doctor. Go to this community doctor that we all know and trust that will honor your health goals," right? So
yeah.
that doctor, I think, was new to trans medicine and health, but instead of saying, "I'm noticing that you have health conditions that make this confusing for me to navigate. Let me refer you, or can we set up another appointment after I've consulted with other colleagues?" They took a hard line stance that was in direct opposition with
Mm,
my health goals for my mental health, right? So
mhm,
it was a quick way to make an enemy of me as a patient. And it was a quick way for me to say, that sounds like bad advice. That sounds uninformed. My intuition is telling me that that doesn't really make sense. And so there may have I can definitely empathize to, like, you may tell your patients things they don't want to hear. That's a little different than like speaking on something that you might not have medical knowledge on, right?
yeah.
The other thing I'll say is that, the therapeutic approach of that's used in a lot of like cognitive behavioral therapy, which definitely has its issues, but it really speaks about the therapist or the person administering that intervention being in partnership with the client and taking this energy of, we're going to explore this together. And
Mhm,
as we've been sharing, I'm like, oh, when I talk about my community advocating together, asking for our blood tests, what I'm really saying is we got to build power together, right? So it's like, if me viewing a physician that way really changed my attitude towards receiving medical care, because instead of being like, oh, I'm going into this disempowered place, I just have to accept whatever they tell me. If I can go in there and say, this person is a partner to support me in my own health goals, the energy really shifts. And I think if you as a physician can embody that attitude with a patient that might be a little out of your comfort zone, I think that that can be really powerful.
mm,
And the final thing I'll say is that a little bit of motivational posters go a long way for me. And so if you are a physician that has a safe zone sticker on the back of your clipboard, or even have like pronoun pins, anything that you can do to indicate to me that you are like some level of intention of being an ally. I don't expect perfection. I don't expect physicians to hold the same views I hold, but knowing that there's an openness to it can really allow me to soften and lean into trust as a patient.
Thank you so much for sharing those. Those
Yeah.
are so beautiful. And I feel like I could sit here and just talk to you for the next 2 hours about these things as well. Like we've shared a lot of community space together, and so
Yeah.
being able to, I feel really grateful in this moment to just hear new perspectives and hear your story as well, because even though when we hold community space, we don't always talk like this. And so I'm really grateful for your time and your energy and your expertise, and helping me to see new ways to conceptualize and move through this work as well.
Thank you so much, Miss Jai. Thank you so much for having me here. Thank you to everyone who has watched this. I just feel like overflowing gratitude, and just so glad to return to my roots of medical advocacy for this little 50 minutes. It's been so joyful.
And I want to wrap us up with the question that I ask all of the interviewees, all of the folks who come on Ask Miss Jai Live. But what brings you joy?
It's such a good question. Um, I think that I feel most joyful in moments like this, where
Hmm.
I'm able to explore passion and share experience and like vision into possible futures with a beloved community member, whether it's one person or many people. Conversations like this, where I feel so passionate and alive and like anything's possible, give me a lot of hope and joy. And then also the dance floor.
Yes, I am here for that dance floor.
Yes.
Well, Opulence, thank you so much for joining us today, and thank you to all of you for watching this. If you're catching this live, go ahead and put your questions, your comments in the chat. If you're catching this on the replay, go ahead and put a hashtag replay. Let us know which pieces you found most interesting around this, or your own experiences, or the ways that you would love to learn more about these topics. We'll also include in the show notes some of the organizations that Opulence has mentioned. That way, if you'd like to learn more about these organizations, learn more about this work, then there are some resources available for you there. And as always, I just want to say thank you for taking the time and the energy, and investing in the health and well being of trans and non binary people. Until next time, much love.